When I see somebody for facial rejuvenation, we can call it that, I like to go through a little discussion about my approach to somebody's face, my philosophy. And I'm going to give you a little quick education guidance about it. So I categorize changes into different areas in terms of rejuvenation. It's a really good way to look at this whole area. There are 4 areas that changes take place in as time goes on. Area number 1 are expression lines, things we do, Botox or Dysport, to relax. Area number 2 is gravitational changes of tissue, things you do skin tightening or sometimes surgical tightening procedures for. So when you're doing something like thermage or Altera, that's a non-surgical way of tightening the tissue. A facelift is a surgical way of tightening the tissue. Gotcha. That's treating gravity. Area number 3 is as time goes on, we can tend to lose some volume in the face. Either we're losing it locally in certain areas or more globally in the face. And that's a whole area that's very important to understand, to look at a person's structure of their face, look at light, look at shadow, to see where the volume might have been lost, and to use things to recontour the face. I like to use the word recontour because it's not just filling. Things in that area are commonly not done very well. If they're not done well or done too much, people look unnatural. So that's area number 3, recontouring the face. And lastly, it's the skin itself. Wrinkles, sun damage, color change of the skin, acne, scars. Here we're treating the skin, and either we're doing skin treatments with the esthetician, products, or many times laser to improve textural changes, to make the skin smoother, to make it look more even in terms of tone. So the 4 areas are expression lines. We're relaxing those with Botox or Dysport. We're repositioning tissue with skin tightening procedures. We're recontouring the face with fillers. And lastly, we're treating the skin to make the skin better. Okay.
What a great approach.
Thank you. Thank you. So let's look at you, and let's see where there's any value. Okay. So I do things a little differently. I don't really ask you, what do you want to do? I really make a determination of where there is value. So let me take a look for a sec. Raise your eyebrows up, scowl hard for me, big smile, relax. Okay. Okay, so very quickly, first of all, you look great. You're a good looking guy, you've got very little going on, quite honestly, in really all these areas. I mean, you don't have a lot of expression lines. Gravitationally, you're quite good with things. Your contour is good. Your skin is very nice. You've got almost no kind of age-related change. So let's now run through each area, okay? Let's start with area number 1, expression lines. Okay. So the common area for Botox or Dysport is area number 1 is here. Scowl hard. Raise your eyebrows. That's area number 2, the forehead lines. Big smile. The little crow's feet around here. So these are common areas for Botox. In your case, you don't have a lot going on, but almost more for prevention and maintenance, I would do a little over here to keep that area nice and smooth. A little tightly around the eyes. You know, when guys are done, you want to keep it nice and tight so you're not causing eyebrow raising, and then you're causing the eyes to look more feminine. You want to keep a nice masculine look to the face, and a little bit in the upper forehead area, considerably for prevention. Area number 2, gravity. You look great. I really can't offer anything to tighten your skin because your skin's nice and tight. We don't have to do anything. I mean, I could talk to you about thermage, Altera for prevention, but I just don't see it's money well spent, quite honestly. I'll just hold off on that for now. Cool. Area number 3, contouring. So this is where I take a lot of pride in how I go about doing it. I look at structure of a person's face. I look at symmetry and asymmetry. Right away I see that the left side of your face is a little bit rounder than the right side of your face, which is a little bit more straight up and down. You might not have noticed that, but this side is a little bit straighter up and down, and this side is a little bit subtly rounder. I look at bone structure of a face. You've got nice bone structure of your face. I look at light and shadow a lot. This is very telltale. Your face has very good light to it overall, but I do see that there's a little bit of darkness under your eyes over here, a little bit of a subtle trough, and that, as I look at your face, you're a little fuller here. You're almost like slightly puffy and full here, when I'd like to see a little more contour in the cheek area, so that the face starts to do, it's harshly like pushing, but do that a little bit more. You see how just that starts to create a little more of a contour and gets it off over here looking a little bit round and soft there. The light reflects off that area. I'd like to see more light here. Soften this with where it's dark. So this is the area contouring the face. It has to be very, very well done. I also look at the lateral part of the face too. It's not just the middle part of the face. A mistake in your case would be to put more filling here. It's going to create a puffy look. We want to take away from that puffiness and to make the face more contoured. So it starts to go in that direction a little bit more, and it starts to match the jawline. You've got a good jawline. We want to do the same thing with the cheekbone area too. So in your case, I would use a little bit of Restylane with a cannula under here to soften that trough, and a little bit of filler material in through here to lift off of here and create a little bit of cheekbone structure that draws the face back like that a little bit, right?
It's like when I was younger.
When you're right, exactly, because it starts to move forward here. So you want to get the focus off of this and bring the light back in the face. So this is where we're going to use another filler material, and this is where we want to use a firmer material like Radiesse or Restylane Lift in through these areas over here to create a little more contour to your cheekbone area.
Gotcha.
Okay, so we've been through 3 areas now. Expression lines, we call that a plan of attack. Gravity-wise, you're fine. A little bit of contouring in certain areas, and lastly, the skin itself. So your skin from an aging standpoint is very good, but you've got some little things going on. You've got some uneven color changes going on, some brown spots, some little broken blood vessels on your nose. You're getting a little bit of slight little acne change in your skin too. So the first thing I want you to see my esthetician to get on a good skincare program. Jennifer's outstanding. We're going to put together a treatment plan for your skin in terms of a combination of a laser to make your skin look a little more even in tone, and another laser to also improve the broken blood vessels on your skin. Okay? Touch it down a little bit. So you had some filler done a while ago?
Oh yeah, over a year.
Was the lower eyelid area done in through here?
No.
See, what it's actually done is it's kind of created fullness here, which is nice, okay, but it creates a little bit of a ridge up in that area. You kind of see that? And it makes that area look darker, and then this area is literally ignored. So we're gonna correct that. Small poke. So we can see right away that ridge is much better.
Oh yeah.
Let's soften that ridge and improve the darkness. So what I'm using a little thin cannula. So it's not a needle, it's blunt. And it's a weird feeling, but it starts right away to lift that cheek area up. You good?
I'm good.
You're a good patient. Right away, it improves the darkness. Head down a little bit. This is round 1. I don't like to make drastic changes, and you really need very little. You really do. But you're gonna see how it starts to soften that darkness below your eyes, okay? And starts to create a little bit of lifting of the face and the cheekbone area. And it softens that roundness in the middle part of your face. So it doesn't look as that ball of roundness. It starts to do that and bring the face up a little bit. So it starts to Yeah, it starts to do this. It starts to
Yeah.
draw. You got such nice looking eyes.
This is gone now.
Yeah, it's much better. And still, there's a little ridge that when it was done before it was created, I can't completely get rid of because the way it was done. But it softens that darkness and starts this. The next thing I would like to do is see you back in a couple weeks, see how things settle in, and maybe do a little bit more right up through here. So it starts to do this and draw the face back a little bit. It looks very subtle and natural, and it looks great. Chin down a little bit, raise your eyebrows all the way, scowl hard, relax for me. Raise your eyebrows, relax. Raise. I like when I do Botox or Dysport to be very subtle, especially in men. Big smile. Relax. Press left hand. Come right out here again. Raise your eyebrows all the way. Relax. So I take a little bit and put it into a lot of areas. Good. Okay, go ahead and take your left hand, Shane. Lightly hold. Take your right hand, lightly hold. And we are done.